So, hi ma'am, I am Kritsan M. Sidayo and I will be your student nurse for today. So, I know your name ma'am.
Pastora Sidayaw.
And may I also know your birthday?
I was born on March 15, 1970.
And your current age?
I am 52 years old now.
Okay, so for today ma'am is I will be assessing your nose and ears. For me to identify if there are abnormalities and for you also to access immediate health care. Okay? And I will be needing your cooperation in which if you are uncomfortable, you can just tell me ma'am, or if you have clarification, you can just ask me. And I assure you that the data that I will be getting from this assessment will be taken in a great confidentiality between you and me and to other healthcare providers that are directly involved in your care. Okay? So before we start, ma'am, do you need first to void?
No.
Okay, I will be just closing the curtains for your privacy and I will be just checking the materials that I will be needing if they are working. So this is my otoscope and let's pretend that it is working and this is my improvised tuning fork. This is my light. So, okay ma'am, I will just perform hand hygiene. So, ma'am, I will inspect your ear, okay, ma'am? So, when I inspect the ear of the patient, the pinna or the auricle is brown in color. It is positioned centeredly and in proportion with her head. And also, there are no foreign bodies that are noted, no redness, no drainage, deformities, nodules, nor lesions. And next, ma'am, is I will be checking your ear canal as well as your tympanic membrane using this otoscope. Okay. Ma'am. So when I check for the ear canal of the patient, the ear canal has no redness, no swelling, drainage, lesions or masses, as well as there are also no foreign bodies that are noted. And the tympanic membranes appears purely gray in color with well-defined landmarks. Okay, next ma'am is I will be palpating your ears. Okay ma'am? And tell me if it hurts you, okay? Does it hurt, ma'am?
No.
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 As well as the tragus. Does it hurt, ma'am?
No.
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 So, upon palpation of the pinna or the auricle, there are no tenderness or masses noted, and there are also no painful reactions that are noted by the patient, as well as the tragus. There are no tenderness or masses noted. And then next ma'am is I will be testing your sensory function of cranial number 8. Okay, ma'am? Using the voice or whisper test in which I will be whispering to you and I will be covering one of your ear and I will whisper words at some distance and you will repeat it. Okay, ma'am? Ready?
Ice cream.
Next, ma'am.
Hot dog.
Okay, ma'am. So, when I test for the voice or whisper, the patient was able to repeat the words that I have whispered. And then next, ma'am, is the Weber's test. I will be using this tuning fork and you tell me if you can hear the vibration equally on both ears. Okay, ma'am?
Yes.
Okay, so when I perform the Weber's test, the patient was able to hear the vibration equally on both ears. Next is the Rhines test, ma'am, in which I will also vibrate this tuning fork and put it on your tragus and immediately on near your ear, and you identify if you can hear the vibration. Okay, ma'am? Can hear?
Yes.
Can hear?
Yes.
Okay, very good, ma'am. Can hear?
Yes.
Please.
Yes.
Okay, so using the Rhines test, the patient was able also to hear the vibration of this tuning fork, and she was able to identify that air conduction is greater than bone conduction. Okay, ma'am. Next is I will be assessing your nose. Okay, ma'am. So first I will be inspecting it. Okay, so when I inspect the nose of mom, the nose is brown in color and it is positioned centeredly in the face. And also it is symmetrical with the shape of the face, and the size also is prominent and there are no flaring, swelling, bleeding, or any lesions noted. So next, ma'am, is I will be checking for the potency of your nose. I will be covering your nose and you must blow the one that is not covered. Okay, ma'am? Maybe blow. Maybe blow. So when I check for the patency of the nose of the patient, both nostrils are patent. Okay, next, ma'am, is I will be palpating your nose and you tell me if it hurts, okay? Does it hurt, ma'am?
No.
Does it hurt, ma'am?
No.
Does it hurt, ma'am?
No.
Okay, so upon palpation, there are no tenderness, masses that are noted, and the patient has not displayed or not felt any pain reaction upon palpation. Okay, next, ma'am, is I will be checking for the nasal cavities and nasal septum. Okay, ma'am, and okay, you need to tilt your head, and I will be using this otoscope. Okay. Okay, ma'am. So when I check for the nasal cavity, the nasal mucosa is pinkish in color. The nasal cavity is not too moist and not too dry. And also there are no discharges noted. There are also no polyp, bleeding, or lesions that are noted. And then next, the nasal septum is also in the midline and the integrity is intact. So next, ma'am, is I will be checking your sensory function of your cranial number 1, okay, or your olfactory nerve. I will be letting you smell this and you identify what is it smells like. I will be covering one of your nose, okay?
It smells like a vinegar.
Okay, how about this, ma'am?
It smells like vinegar.
Okay, so you are able to identify it, ma'am. And then the patient was able to identify the smell of this sample, and it is vinegar, and therefore I conclude that the sensory function of cranial number 1 of the patient is intact. So, ma'am, thank you for the cooperation, and there are no abnormalities that I have seen. Okay, ma'am, so don't worry. And that's it, ma'am. I will just document the data that I have found on this assessment. Okay? Thank you.
Thank you.